for sitting and listening to me for the next 10 minutes or so. So I'm Christine Certain. I'm the Director of Clinical Operations and Innovations for Children's Home Society, which is actually a really cool job because I get to work for a company that has refused to accept the status quo for children for over 115 years. So I'm going to back up. I know Carrie knows about Florida history quite well, but for those of you who are not familiar with the history of the state of Florida and the state of Jacksonville in particular, which is where we were founded over 115 years ago, I'll give you just a quick history lesson. Let's see. So in 1902, there were what were called orphan trains, and they would run all the way from New York down to Jacksonville. And they would stop at each stop along the way and try and find homes for the kids who were left without families. At every stop, a lot of the older kids were getting picked. There were more hands that could help on the farm, right? But the younger kids were having trouble being placed. So a lot of times they would make it all the way to Jacksonville without having a family to pick them up. So CHS was founded on the principle that this was not okay, that there needed to be a home, there needed to be a safe place for these children. They shouldn't be left to their own devices to raise themselves. Of course, this wasn't a great time to decide to try and get homes for kids in Jacksonville. 1901 was the year of the Great Fires, which devastated the majority of the city. So a lot of the families that could take in the kids weren't able to because they didn't have homes themselves. But we decided, despite this, we were still going to do the right thing. So the first year the CHS was founded, we helped 400 kids, which doesn't sound like a lot, especially when a lot of the numbers we're talking about today are in the billions. But to those 400 kids, this was everything, right? This was a family, it was a home, it was people to care for them. So that is the mission, I think, to me, drew me to work with CHS, and that I try and hold true every day in the work that I do. So fast forward a lot of years to 2016. We had been offering behavioral health services across the state of Florida for about 45 years, give or take. This was actually a job ad that we would post at the time, right? Because what we needed was someone who's willing to jump in a car and had the appropriate credentials and would go drive an hour, sometimes 2 hours, to go see one child for one appointment for therapy, because that was totally worth it for them. And the fact they couldn't see that many kids, they couldn't make that much money, that was not what was important. What was important was helping them. We knew that this was not the best plan that we could have had, right? We were dealing with kids who had high trauma, were high acuity, a lot of families that were really in distress. And we wanted to be able to recruit the best clinicians for the case all of the time. And we have some of the best clinicians that just so happen to be willing to be road warriors and get out there. But we wanted to do it better. Again, right, not the best time to decide to take something on. So this headline probably looks familiar to you guys from when the New York Times did an article about how Florida was being sued because access to care for children with specialists was so poor. One of the highlighted stories they had in there was about a little boy who had to drive 3 hours to go get tested for lead poisoning because that was the closest facility. I can vouch the reimbursement, and I'm sure Carrie can too, that the reimbursement rates were quite poor. So the lawsuit was won, and they decided that they would work to increase reimbursement rates, to increase care to kids, which was great, but still we have this healthcare provider shortage area. So Florida is not just Miami, Jacksonville, and Orlando. There's lots of very rural areas in between where really these specialists don't live, and they're not necessarily willing to travel 2 hours to get out there to maybe help one patient that day. So the wait lists are really long, and a lot of these families that we work with don't have transportation to be able to get over to us. So again, we knew we had to do something. We had to do something better than what we were doing before. So enter the telemedicine solution. Originally, when we found out about telehealth services, it was this word that kept appearing in the new Medicaid handbooks that we were supposed to be following when they revamped them, and we weren't really sure what it was. So we started doing some research and looking at it from an innovation perspective. Could this be a solution worth trying? We were so excited about it that we actually decided to pilot it throughout the entire state. So all the way from Pensacola and Jacksonville in North Florida down to Miami. We opened up clinic offices, and we partnered with the University of Florida and their child and adolescent psychiatry team to be able to do this. So we did it for a year, and then the interesting part for me was that we compared the data for our first year of services in telehealth with the doctors to the data with our providers that we had the year before. So just a point to note in this. At that point, the way the Florida laws were written, the clients had to come into an office to see a telehealth provider. They couldn't do it from home. Our no-show rates for our second appointment actually decreased 10% as a whole in 1 year. And the difference in there was not the providers, it wasn't necessarily the amount of wait time, because they would still have to wait if the appointment before ran over, but it was the computer. And I had a teenager who told me that, or told her doctor all about all of these things that had happened to her, and he said, well, you've been in therapy and you've been with a psychiatrist for like 7 years. How have you never told anyone about all this? It's really important. And she said, well, it's not like you're in the room with me. So he said that for him, that was the point where he realized that this telehealth really had a point and it had a case. For me, because I really like the little kids, it was when we finally convinced a mom to come in and try services with us and not sit on a wait list for 6 months. And she came in and her 6-year-old had the appointment for care, and we went and we knocked on the door after 45 minutes to bring them out to schedule their follow-up appointments. And the little boy runs up to the computer screen and gives it this big bear hug, right? So for the mom, if she didn't know just from the quality of the interaction for the appointment before, that's when we all kind of collectively came to the decision, the computer is not this cold metal plastic piece that's inhibiting actual care for behavioral health services. The services can be just as rich and just as meaningful and can decrease the wait list and ultimately expedite better health care out to children, because they're not seeing just whoever's available, they're waiting for the right provider for them. So it's been great. We've expanded our services tremendously. About 10% of our behavioral health services between counseling and psychiatry today, and 10% of our patients are served through our telehealth solution. And our satisfaction rates have shown to be really good. So this year we have decided that what we really need to focus on is getting the word out about the services, because people who come in and try it, they come back, which is fantastic. But we need to get more people in the door to actually try the services. So we're focusing our efforts, actually Anthem, the insurance company, was great in helping to partner with us on this, on a telehealth awareness campaign. So through social media, Twitter, Facebook, Instagram, all of that, you name it, where the teenagers and the adolescents are.
It's so hard to fit in. I always felt like people were judging me.
So here is our video that went live with our campaign.
Nobody tells you. When you have a baby and leave the hospital, you're on your own. It's 24 hours a day, no breaks. My life just disappeared.
I thought therapy was for crazy people. I didn't need one more person sticking a label on me.
I grew up in a house of strong, silent types. Nobody spoke about feelings. And getting help, that was for the weak.
People were saying, hey, talk to a counselor, get it off your chest. How? When? I mean, I don't have a ride. Where would I even go? Stuck in a room with a stranger? Talk about anxiety.
At the hospital, they mentioned therapy, and I'm like, when do I have time?
But I felt hopeless watching my daughter struggle, and she wasn't getting any better.
I finally hit the end of my rope.
Then a friend suggested trying telehealth with Children's Home Society of Florida.
So I thought, talking to somebody through a private app on my phone is better than trying to deal with being a mom on my own.
No couch, no judgment, just a down-to-earth conversation with a counselor who really cared about my daughter.
My teacher said I can do it online, and my therapist is there for me whenever I need her, right in my hand. It's like just sitting down with a friend, just talking.
I hated looking at social media. Everyone had the perfect life. I didn't think anyone could understand how hard it was for me. My phone was making me miserable, but now it's giving me the help I need.
I finally feel like I have my daughter back. She smiles again, she talks to me,
I'm finally inspired. Some of the answers are inside me, and my counselor really helped me figure it out. I'm becoming the person I've wanted to be. I'm happy.
I know I'm not alone now. I'm healthier. And so is my baby.
So that is part of what we're going to be focusing on in the next year, is getting telehealth awareness out so people start to hear the word, so that when I talk to my real estate agent and I tell her I do telehealth, she doesn't look at me like, what is that? The other part of what we're doing is we're working with our schools that we've partnered with across the state, including our community partnership schools, which is also a really interesting idea. I'm glad to hear so many people talking about integrating healthcare into the school systems. It's something we've definitely believed in for about 10 years now. But we are offering more of our telehealth services, kind of creating that warm handoff, right? Because like I said, we know that if they try it, there's a really, really good chance they're gonna come back. So if their teachers endorse it, if it's something that gets introduced to the family in a comfortable, safe place, we can really create a world where we have less healthcare provider shortages. So that's it. Thank you.
That's great. Thank you. There's a pretty big shortage of behavioral health experts in the country. What are you doing to address that?
So telehealth has helped us address that in the state of Florida. So we are a Florida-based organization. We actually don't go outside of state lines, which in this situation is a benefit because we don't have to navigate as many state regulations. But for the state of Florida, it's been wonderful. So there is, last I checked, which was right before I came to the conference, 376 certified child psychiatrists in the state, which is really not enough to meet the need, especially because many of them are probably not practicing. But we've been able to expand access out to kids and families in especially more rural areas using telehealth.
Any other questions?
Sure.
How with the schools, obviously there's some red tape there dealing with the different school districts. How do you facilitate those different relationships, being, everyone's kind of different on the vendor process?
Sure. So I think what's been really helpful for us is that we have started out with this idea, before we ever talked about telehealth, about community partnership schools across the state. And community partnership schools is all about bringing partners to the table. So it's not about service providers, it's about a healthcare partner, a university partner, a local school partner, seeing if we can band together to that old adage of it takes a village to raise a child. Can we all come together and be that village? So that has opened a lot of doors for us.
Maybe the last question there, Brad.
Thank you very much. This is actually really inspiring on a couple levels. One of which, I'm an emergency medicine physician who work over 50% of my shifts in the PEDS in Tucson, and there are literally no services. Even in the cities, we will board kids for a week. So first part of the question is, do you take kids, or do you do teleconsults within emergency departments yet within Florida?
We've had some conversations, but we haven't started those yet. But I definitely think it's a need.
I can tell you, I just got back from the American College of Emergency Physicians meeting, just literally drove up, and there was one of the resolutions we passed was specifically addressing this issue. And so I think the solutions people are really looking for, and it seems like the people in this room, yourself included, are really well poised to put the solutions out there. So approach the state boards, our colleges of emergency physicians, and then PEDS. Approach it that way.
Sure, absolutely. You're right. I think the best innovations don't happen in the silos that we've created. They happen in collaboration, which is neat to see everyone here today with that same understanding.
Christine, thank you so much.
Thank you.
That was so good.